You're watching Rogers TV, Barrie.
Hello, I'm Charles Gardner, Medical Officer of Health with the Simcoe Muskoka District Health Unit, here to provide you with the COVID-19 update for Simcoe Muskoka. So when I last reported, October the 13th, since that time, we've had an additional 130 cases, so up to a total of 13,836 cases. This actually is a reduction over the preceding week. So we've had an 18% reduction in week-on-week cases. For the week of October the 10th to 16th, that was 111 cases, compared with the preceding week at 135 cases. And during this time, the province has also had a reduction of 25% in their case count. We were experiencing over a 5-week period, a reduction in our cases week after week. And then 2 weeks ago, the week of the 3rd of October, we had an increase at 135 cases. And then in the past week, we've had a reduction down to 111 cases. So last week, I had expressed some concern about the increase. It is good to see it coming back down again, though we do need to continue with caution in our response to the pandemic. So the number of active cases in Simcoe Muskoka has also gone down over the past week. We now have 145 active cases compared with 153 the week before. And we have had no additional deaths from COVID-19 over the past week in Simcoe Muskoka. So therefore, a total of 262 deaths throughout the pandemic. We have a reduction in the number of people in Simcoe Muskoka in a hospital with COVID-19 over the past week. So it's now 8 compared to 10 the week before, and a slight increase in the numbers in the intensive care unit among the 8. So that's a total of 4 people in the intensive care unit, up from 3 the week before. So those in hospital range from in their 20s to their 70s. They're all from Simcoe County. 6 acquired their infection in the community, which means we don't know what the contact was. 1 was a close contact of a case, and 1 was part of an outbreak taking place out of jurisdiction, so out of Simcoe Muskoka. 4 of the cases were not vaccinated, and 4 were fully immunized. 3 of the 4 in the intensive care unit were fully immunized, 1 without a record of immunization. So this is higher than we've seen in the past, I would note. And I have noted in the past that we expect over time, as we get ever closer to immunizing the entire eligible population, or getting close to that, the cases that will remain will be breakthrough cases. The number is going down over time, but as a percentage, they would be going up because of those number dynamics. Today, we've had an additional 25 cases. 17 are sporadic cases. 1 is part of a school outbreak. 5 are part of an institutional outbreak, a corrections facility. 2 are institutional outbreak related, but are from out of in an outbreak out of jurisdiction. 13 are male, 12 are female. Their ages range from under 10 to in their 50s. 11 of the 25 are children under the age of 18. And 10 are sporadic cases, and 1 is from a school outbreak. Of the 11 that I'm speaking to, the child-related cases. So the majority of our child-related cases this week are not due to school outbreaks. 20 of the cases reside in Simcoe County, 5 in Muskoka. With regards to their acquisition, 8 are under investigation. 8 are due to being close contacts of a case. 7 are part of institutional outbreaks. One is part of an educational facility outbreak, and one is travel related. All are self-isolating, so none are in hospital. 14 are unimmunized, 3 are fully immunized, and 5 are not eligible to be immunized. The highest incidence of cases is in South Simcoe, 36 cases per 100,000 population in Innisfil, and above 30 cases per 100,000 population per week in Springwater and Oro-Medonte. Overall, our weekly incidence for Simcoe-Muskoka is 18 cases per 100,000 population per week, down from a week ago when it was 22 cases per 100,000 population per week. And provincially, the rate is 20 cases per 100,000 population, down from 26 cases per 100,000 population a week ago. 18% of our cases in the past week have occurred among children under the age of 12, therefore not eligible to receive vaccine. And this is down from 2 weeks ago when it was 30%. And 19% of our cases are considered to be community cases, community contact. By that we mean we don't know how they were acquired. And this is actually down from previous weeks. 100% of our cases are due to the Delta variant. And this has been the case for several weeks now. We have 5 ongoing outbreaks, up from 4 a week ago. So 2 educational settings that are new that have been declared as outbreaks, and 2 other educational settings that are ongoing as outbreaks, and 1 long-term care facility, Mill Creek Care Center in Barrie, declared as an outbreak on October the 15th with a total of 2 cases. And a corrections facility outbreak with a total of 11 cases, 5 of them considered to be local citizens, and six are individuals from out of jurisdiction. And 2 of our outbreaks have been declared over. 1 a congregate setting in Simcoe County, and 1 a school in Simcoe County. With regards to our school outbreaks to date, we've had since September a total of 9 confirmed outbreaks, all of them in elementary schools. So this is important given that these children are too young to receive immunization, whereas we have a fairly high vaccination coverage rate among students in secondary schools, helping to protect them from outbreaks. So among the 9 confirmed outbreaks in schools, 6 of them I believe 5 of them are declared over, and 4 of them are ongoing. With regards to immunization, the province's target is 90% vaccination coverage for those turning 12 and above, first and second doses. And we continue to make progress towards that goal, with 86% of our population having of our eligible population having received 1 dose, and 82% having received 2 doses. And the 82% figure is up 1 percentage point from last week. So it had been 81% the week before, and now up to 82%. Our coverage is lowest among young adults, 18 to 29, in particular males. And we are administering 3rd dose vaccination for residents in long-term care facilities. And so far have administered more than 2,400 vaccinations to those individuals, and are now proceeding with providing 3rd dose immunization to the residents of retirement homes, which we are targeting for completion by November the 8th. And currently, over 5,200 Simcoe Muskoka residents have received a third dose vaccination. There are others who are eligible, those who are immunosuppressed due to a medical condition or treatment with very specific criteria are also eligible to receive a third dose, being administered through their point of care, their clinician. And when necessary, with a note from their clinician, can be administered at our clinics. For those who are immunized in Simcoe Muskoka, based on their data, they have a high degree of protection against becoming a case or being hospitalized. So people who are not vaccinated have a 10-fold increased risk of becoming a case and a 23-fold increased risk of becoming hospitalized from COVID-19 compared with people who are fully immunized. And over the past week, the week of October the 10th, the most recent week for which we have this data, 39% of our cases of COVID-19 have been breakthrough cases occurring among people fully vaccinated. And this is increasing over time. We expect it to increase over time because it is partly a function of how complete our vaccination coverage is for the population as we proceed with vaccinating more and more of the population. The proportion of our cases that are breakthrough cases will go up over time. That does not change the degree of protection that occurs for people who receive immunization. The fact that if you're not immunized, you're 10 times more likely to become a case and 23 times more likely to be admitted to hospital. That does not change, even if the percentage of breakthrough cases changes and increases over time as we progress towards vaccinating more and more of the population. When we look at our dashboard, we remain in yellow status with regards to viral spread and containment, green status for laboratory testing, the turnaround time for testing, health system capacity in green status, and public health system capacity in red status, as we are still challenged in reaching cases and contacts over time. Our response rate within 1 day for cases is 76%, and our response rate for contacts within a day is 70%. Our percent positivity in Simcoe Muskoka is 1%. So 1% of tests that are being done are coming back as positive, compared with the province's 1.9%. And this is similar to the past week. It's an indicator of the sufficiency of testing as well as the degree of transmission in the community. Anything above 3% is of concern. So some key messages. We are proceeding with our annual flu vaccination campaign. And the province has positioned this to be the largest influenza vaccination campaign in history, with the largest quantity of vaccine that they've purchased. And we do know that last year there was a very low rate of transmission of influenza due to the public health measures in place, the distancing and the masking and other measures that really help to reduce transmission against respiratory infections, including influenza. All of that was in an effort to control COVID-19. And with some of the relaxation of some of those measures, we may find that we're at a higher risk this year compared with last year for influenza transmission. And I always advise people to come forward and receive your annual influenza vaccine, particularly people who are at higher risk. So those that are above 65 years of age, pregnant women, children under the age of 5, and people with pre-existing medical conditions such as heart disease or respiratory diseases, in particular would benefit from the flu shot. But everybody 6 months of age and above are eligible to receive it, and I recommend it. Certainly with COVID-19, it would be beneficial to avoid a respiratory infection. And in addition to receiving COVID vaccination, by receiving the flu vaccine, you help reduce your likelihood of getting that other respiratory infection. And influenza is also a very serious infection. It's just another means of avoiding a disease of that nature. So in October, the supply that we receive, we distribute to healthcare facilities and long-term care facilities, and to family physicians to provide to high-risk individuals, the groups that I already mentioned, and community pharmacies also receiving vaccine. More than 160 local pharmacies are receiving the influenza vaccine. So starting in November, there would be a campaign to provide vaccination to the general population. And we advise people to reach out to their healthcare provider or to your community pharmacy in order to receive the vaccine. Pharmacies can vaccinate anyone above 2 years of age, just so that people are aware of that as well. And also we can give influenza vaccine concurrently now with the COVID vaccine. And this is a change under the advice of the National Advisory Committee on Immunizations. And it certainly makes it easier for us to be able to administer both of those vaccines. It makes it easier for people to receive the protection from both of those vaccines. So that's something now, another option for those who've not yet received their COVID vaccine, that they could receive both it and influenza at the same time. We have on our website a lot of information about COVID-19 in general, and specific information about vaccination, including sociodemographic information, such as our coverage rates of neighborhoods based on ethnic diversity or based on material disadvantage, income. And we're finding through the efforts that we've made in partnership with community advisory groups, and that we've been able to close the gap on the differences between these neighborhoods over time. So our data now shows that there is no difference in vaccination coverage for neighborhoods that are most ethnically diverse compared with those that are least ethnically diverse. Whereas in the past, there was a difference there. More ethnically diverse neighborhoods had a lower vaccination coverage. So now they have the same, and we are getting over time less and less of a difference based on disadvantage and affluence of neighborhoods. Our efforts certainly will continue with regards to meeting that need. Just some messaging with regards to safeguarding our schools. So I've already pointed out the number of outbreaks that we've had in our schools, elementary schools in particular. And it's very important that those who work with children, and those who provide care for children, parents and others, receive your COVID vaccination to help protect not only yourself, but also the children that you are in contact with who cannot receive the vaccine. And also that all the other measures that are in place related to keeping schools safe be carried out. And for guardians and parents, this would be the screening of your children for symptoms before they go to school each day, and withholding them from school if they have any symptoms, or if they've had contact with a possible case of COVID-19, and to seek assessment and testing. Otherwise, to be abiding by the other measures that are required, including mask use in the school setting. We do have to prepare for immunization of children 5 to 11 years of age. So Health Canada has received its submission from Pfizer for the vaccination of this group. And we do anticipate approval coming. And from there, the recommendations from the National Advisory Committee on Immunizations, NACI, and then the requirements that would come from the province. And if all of that proceeds as we anticipate, then we would be commencing immunization of children. And thus, we are preparing to do that. One of the things I would say is that we have had to not proceed with the catch-up vaccination of students in grade 7 against meningitis, hepatitis B, and HPV vaccine. We were planning on proceeding with catching up with immunizations for grade 7 and grade 8 students against those vaccines in the school setting. And because the child 5 to 11-year-old vaccination for COVID-19 is proceeding sooner than we thought, and because of all the booster doses that we've had to provide as well for the congregate settings and the potential for booster shots for other groups dependent on the requirements of the province, we are going to postpone proceeding with the catch-up immunizations for grade 7 and grade 8. So we are planning now to do the grade 7 vaccinations for those that are in 7 now. We're planning on doing it when they're in grade 8, and for those that are in grade 8, that we would be catching up with them later in grade 8 and in grade 9. And we certainly regret this, but we do have to prioritize in order to continue to respond effectively to the pandemic. Certainly, individuals who wish to proceed with their immunization can reach out to their primary care practitioner to inquire about this. And we would be happy to take a phone call or for people to check our website for further information related to this. So at this point, I'd be happy to take questions from the media.
Thank you so much for your update today, Dr. Gardner. We will take some questions from the media, as always. We do ask that you kindly please limit yourself to one question and one follow-up in consideration of time. Can we start with Brett Glover from Barrie 360? Do you have a question today?
I do. Thank you very much. Doctor, as you noted, we're coming up on flu season, and with some influenza and COVID symptoms overlapping, when would somebody know when to stay home from work or school and perhaps seek testing as a result?
Oh, certainly anyone who's had symptoms that are respiratory in nature, actually very mild in nature, if you're simply feeling unwell, certainly aches and pains, nasal congestion, coughing, sore eyes, loss of smell, loss of taste are classic symptoms of COVID-19, more so than other respiratory infectious diseases. But any of those other symptoms would be grounds for staying home, seeking assessment. And also if you've had contact with a case that potentially could be COVID-19, certainly cases that have been demonstrated to be COVID-19 would be grounds for staying home. And even if it turns out to be another respiratory illness and not COVID-19, it does help to safeguard the work environment.
No, thank you. And you've already addressed my follow-up earlier, so thank you for your time.
You're welcome.
Mary Beth Hartle from Muskoka Region, do you have a question?
No, I'm actually good today. Thank you.
Great, thanks. Can we go with James Bowler from Cogeco? Do you have a question today?
I do. Thank you very much. Dr. Gardner, first of all, I wanted to ask you about Halloween coming up again. Again, deja vu and having this conversation, but where are we? What would your suggestion be, I guess, this year? Things are opening back up. We're allowing more people to get together. What's your main message to parents right now about this holiday or this event?
I would say that for one, we're in a better place now than we were last year at this time. But many of the people that participate in Halloween are below the age that they could become immunized, probably the majority. So they remain vulnerable. that they need to take precautions. Everybody involved needs to take precautions. Using a mask, a respiratory mask within the costume would help to reduce the risk. And maintaining distance to the best of your ability helps to maintain and reduce the risk level for all involved. For those that are providing the treats, same, it would be prudent to wear a mask and to maintain distance as best you can, noting that that will be perhaps a bit challenging as you're handing out candy, and to frequently hand sanitize. Certainly, people who have symptoms should not participate in Halloween, and other activities related to Halloween, such as parties, would probably be greater risk because they would tend to be indoor, crowded events, and it would be best not to conduct such activities. And if you do, you need to abide by the gathering limit of 25 people indoors. It'd be preferable to have less than that, and to abide by distancing mask use, particularly for those who are unimmunized. And I always come back to the question of immunization. People should, if they're eligible, seek immunization.
And my follow-up question, going in a completely different direction here. Well, basically half of municipalities in Muskoka have now moved forward with vaccine policies. All of them at this point are not taking a hard line on mandating vaccines, but rather allowing people the opportunity to make the choice not to get vaccinated, but they will have to be tested on a fairly regular basis. I'm just curious your thoughts on this. Should these communities, and I'm not sure what's happening on the Simcoe side, but should these communities be taking a harder line on this vaccine policy?
It's certainly important to have a strong policy in a high-risk environment. So healthcare environments are high-risk environments, and there, the Council of Ontario Medical Officers of Health advised the Premier that strong mandated policies with direction from the province would be best in a healthcare setting for healthcare providers. And so in other environments, I've written a letter of advice to employers, and that would include municipalities, that they have a policy for their work environment, that they assess the degree of risk with regards to how stringent that policy would be. I think in many instances, testing for those who are declining to be vaccinated would be a reasonable option. I still would support any employer that would want to go beyond that and have a strong policy that absolutely requires it. But in a situation that's a lower risk, not a healthcare situation, or providing the care for vulnerable populations, I think it would be reasonable to have a policy that educates and supports employees to be vaccinated and requires them to provide some indication of their status, and to test those that are not able to be vaccinated or decline vaccination.
Thank you for your time.
You're welcome.
Erica Engel from Collingwood Today. Do you have a question?
Hi, thank you. Yes, I do. Dr. Gardner, my question is about capacity limits. There's been some loosening of those, and potentially more to come with places like restaurants and gyms asking the government to lift or at least loosen capacity limits for the sake of their business. Just wondering what you think of this in areas where vaccinations are required.
So I can certainly understand why they would want to lift capacity limits with regards to their businesses. And also, we have had some success now in dealing with this fourth wave, this Delta wave. I would say that we need to gain a little more experience with regards to the capacity limits that have already been lifted in some very large venues in order to see its impact. I would recommend taking time and a stepwise approach in lifting the capacity limits in other venues, such as the ones that you've cited, restaurants and gymnasiums. There have been instances of transmission in those kinds of environments in the past, so we do need to be careful. So to my mind, I would be supporting the words of the Chief Medical Officer of Health, Dr. Kieran Moore, that we need to take our time with this.
Are you also fielding questions or otherwise from local businesses who would like to see those capacity limits lifted and who are frustrated at still being limited?
We get many calls from businesses about the requirements, details of the requirements, some concerned, some opposed. I do not doubt that there are many who would want to proceed with opening up, but I think it's important that we do so in a very careful and safe way. We do not want any kind of a setback. We've had some success so far, and we want to continue progressing in a successful way.
Thank you. And just one last point, I was wondering if it might be possible to start getting vaccination rates for hospitalized cases and in general on the website, just to get an idea of how many vaccinated people are in hospital or becoming hospitalized.
Okay, thank you for that. I will take that back. We have data with regards to breakthrough rates for our cases overall. I'll go over that with my team and see what else we can do. I've provided that kind of information verbally, but I think you would want it on our website as well.
Yes, please. Thank you.
Chris Simon from the Barrie Advance, do you have a question today?
I do. Thank you very much. Dr. Gardner, with regards to the approval of the Pfizer vaccine for children, you had mentioned about how other vaccinations have kind of had to be put off because the approval could be coming quicker than you anticipated. Do you have an updated anticipated timeline for approval at this point when it may be rolled out locally?
I have been informed that it probably would receive approval sometime in November. And although we were originally told we could expect the rollout early in the new year, it seems more likely now that it will actually take place within this calendar year to begin with.
Okay. And I mean, what complications are there potentially with rolling out a vaccine like this for children between the ages of 5 and 12?
It will be, to my knowledge, the largest campaign of its nature in history. I guess one would have to go back to the polio immunization years to look at a similar kind of event, mass vaccination of young school-aged children. It's not something that they can receive on their own. They're going to need their parents with them for consent and for comfort. And so there's the potential for much higher emotion related to this, and taking more time because of that, the need for the added sensitivity in working with young children in providing vaccination and doing it en masse. So we have those challenges to work with. And we don't know what the uptake will be as well. And we may very well find there's also increased opposition as well, providing immunization en masse to children. So those would be some of the challenges related to the situation.
Thank you.
You're welcome.
Can we go to Mike Arcelides, CTV Barrie? Do you have a question today?
Yes. Good afternoon, Doctor.
Good afternoon.
Any indication from Thanksgiving on whether there were any cases as a result of folks inviting, that one holdout who didn't want to get vaccinated? Anything result from there?
So we are looking now for any evidence of a surge or an increase in cases. A year ago, we had a 15% elevation in our cases. It was related in time to Thanksgiving gatherings, but it's a little early to see it. You really see it about 2 weeks out from the event itself. So we'd be looking this week to see evidence of that.
And so far, nothing of that nature. No one's saying, grandma was sneezing all over me.
We're not seeing it in terms of an elevation. In fact, we've had a reduction over the last week compared to the week before.
So does this surprise you at all that we're relatively low? And, we had from 32 cases one day to 15 the next. Erratic, no?
There is some variability from day to day. I think you really need to look at week on week trends to make sense of the data, and then look in detail about what might be happening when you see an elevation, like I did a week ago with regards to a relative increase in child cases when we had an increase overall and some relationship with school outbreaks. I think it's too soon to say what may come of Thanksgiving. We really need to see the data this week in order to make a determination about that.
So when do you think it's going to get really bad, if it does?
Well, hopefully it won't. We are headed in the right direction right now. We are finding that immunization is really having a profound impact on the control of this fourth wave. It's quite possible that the ongoing level of protection, the duration of protection, is contributing to that. We have a high degree of coverage, and we're pursuing an ever higher degree of coverage. I don't doubt that we will need to maintain at least some of the basic public health measures through the winter to be secured as well, such as mask use in public spaces and distancing. But if we're very fortunate and we continue working in this way, this careful way, it's possible that we could avoid a surge. We do have the entire fall and the winter ahead of us, so we do need to be careful. There's plenty of time for a surge to happen yet, but so far we're doing well.
Thank you.
You're welcome.
Mark Claremont from Muskoka Today, do you have a question?
Yes, thank you very much. Doctor, regarding the grade 7 and 8 postponement, two things. Is there any risk in doing that? And also, could you expect some kind of I wonder whether there was an evident pushback against vaccines for grade 7 and 8 in previous years, given what we know about today in 21, whether or not there's some hesitancy or reluctance on the part of some families to engage in any course of vaccines?
So with regards to the risk of postponing immunization, those are important vaccinations. And when we are forced to postpone, then that cohort carries the risk that they would experience infections from those diseases, hepatitis B, meningitis, and HPV. As time goes on, the longer the duration of time before we can get to them and immunize them, the greater risk there would be, the greater the likelihood that some of the people in that cohort would become infected with those pathogens. If you're asking about past hesitancy, we've had high coverage for most of those vaccinations for many years. The one that I think was most difficult has been HPV vaccine. But even there, we got the majority of people willingly receiving that type of vaccination.
Okay, that's good. And also on the concurrent situation that you're discussing regarding the flu and the COVID, is it possible that people could go to a pop-up clinic to receive the flu vaccine only?
Only. We would you know what? I think that's a good question. It's not something that we're actively promoting at this time. The primary purpose of the pop-up clinics is COVID vaccine. Later on, as we get into making flu vaccine available in November to the broad population, we would also make the flu vaccine available in our pop-up clinics. If an individual were to show up and want only the flu vaccine, I'm sure we would accommodate them.
Good. And just one final thing, I'll just give a plug. I'm a Rotarian, and this coming Sunday, October 24th, is World Polio Vaccination Day, and we're quite a champion of that, being Rotarians and that sort of thing. And so there's a number of events that people may come across to end polio now there. Anyway, that's good. Vaccines are still in the news, and they do actually work there. Thanks.
Well, congratulations on your involvement with that. That is one of the profoundly important efforts internationally to eradicate polio, to end it utterly and completely. We are very close internationally to achieving that, but we've been unable to finish the job completely. There have been certain countries in the world where it's been hard to get to the very last case and vaccinate and prevent the very last transmission. We've only managed to eradicate one disease in the past, and that was smallpox disease, certainly an important disease to have ended, and that was done through mass immunization around the world, such as the effort that you're describing now with the Rotarians for polio.
Yes, Afghanistan's a stubborn spot right now. But thanks very much.
You're welcome.
Are there any questions from the phone line today? Okay. Is there?
Quick, Mike Garsleeves from CTV. Just some clarity on those schools. Can we have names for those ones? I'm just seeing a little bit of a discrepancy, or maybe something's missing because it's mobile on my phone. But could you, Doctor, name those schools that are in outbreak currently of the 4?
So we haven't been doing that as a practice.
It's on the website, right? So
not generally speaking, I haven't been naming the schools as I report on them with regards to the outbreaks.
Okay, Kara. So if Kara can, if you can send me any information, I just need confirmation that St. Joseph's is on that list. The school board is saying 3 and 5 classrooms closed.
I can follow up with you after, Mike.
Thank you.
Okay.
Also, could I ask you, the correctional facility, is it in Simcoe or in Muskoka?
It's in Simcoe County.
Yeah, thank you.
Was there anyone who didn't have the opportunity to ask their question this afternoon? Okay. Well, thank you so much, Dr. Gardner, for your update today. This brings us to the end of our media briefing. We will have another media briefing on Wednesday, October 27th. Thank you so much.
Thank you. Bye-bye.
Yeah. Bye.
Recording stopped.
Awesome.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
This is when the fun starts.
All right, let's get started.
you would need to let me take over.
Whoa, Nelly. You're not done.
Hey!
Welcome to season 2 of Canada's Drag Race!
I can see things that your people can't.
Focus better.
Partner better.
Sleep better.
Breathe better.
Love better. Work better. Friend better. Unwind better.
Everything gets better when you get active.
All right, welcome back to Inside Mental Health. We have Tara Filto with us today, and she is a founder and CEO of Mother-Daughter Empower. She's talking about female mental health with us today. So Tara, thanks again for being with us. Can you tell us a little bit about Mother-Daughter Empower? This is a great initiative, a great organization, so needed. Can you let us know a little bit about it?
Yes, absolutely. So Mother-Daughter Empower is a social enterprise, and our mission is to empower the next generation of young girls to have the confidence to be who they are so they can grow up and become anything they want to be. And we really do that by inspiring moms to empower their daughters, because that's kind of where it starts. And we offer, different workshops, programs, and services for moms and daughters. We have a free online community and monthly mother-daughter toolkit that we offer. And then we do the National Mother-Daughter Conference, which is turning into an international one because we're doing it online this year. Thanks, COVID. And we do mother-daughter retreats as well. So our goal here is to really bring mothers and daughters together to connect, communicate, and create memories that will, last a lifetime, and learn and grow together. And we focus on girls that are ages 7 to 14, because as I talked about earlier, that's really the stage where, confidence seems to take a shift, and we really want to get in there and be proactive before the teenage years.
It's amazing. That is so great. And I know that you have daughters, so how did you come up with this initiative?
Yeah, it's a funny story. So back in 2018, I actually ran for council in my local municipality in Innisfil. And so I obviously didn't win, but I learned so much through that experience. And I really kind of threw myself out there. I was advocating, as I still am today, for better traffic safety in and around our kids' school. And I said, you know what, if I've been doing this for a while, let's just throw my hat in there and advocate for change. And so through this process, my daughter was 7 at the time. She's 10 now. She took such an interest in wanting to come out to all these events, door knocking. She was riding her bike while I was giving out flyers. And we bonded so much through that experience. And I learned so much more than I could have ever expected. So through that experience, obviously she was learning as well. And she would ask things like, what is the difference between, a mayor and deputy mayor? And I mean, at her age, I didn't even know who the premier was. So it was just mind blowing how much she was learning through this experience that I thought I was, embarking on. So once that council dust settled, I had enjoyed how much, we had learned together, and I was looking for more opportunities out there for moms and daughters, whether that was, in community involvement or programs and services. And as I was searching, I came across that stat that I mentioned earlier, that girls by age 7, their confidence levels are the same as boys, but by age 14, their confidence levels will decrease 30%. And I thought, wow, there has to be somebody out there that's doing something about this. And although I came across a few organizations, I couldn't really find what I was looking for. Right. So I spent a few months, thinking, this is something that we want to do. And I talked about Sophia, and she was like, yes, we need to do this. So lo and behold, Mother-Daughter Empower, I think we came up with the name and the idea in February, and June 2019, a few months later, we had launched.
Wow.
So it's been about a year and a half, and that's how it all began.
Yeah. That is amazing, because I even think about your daughter watching you and what you do, and how much you advocate and how much you speak up, and just looking at you and saying, like, I want to be that way. So when you put mother, daughter, because you could have just said female in general.
Yep.
The mother and daughter relationship is so huge. So I really appreciate you.
Thank you.
That initiative.
Thank you so much.
I actually joined Mother Daughter Empower, but my daughter, she's 6 months old, so she's not really ready to join me out there. It was just so inspiring, and I thought, no, I want to be a part of this. I need to be a part of this. And
Yeah.
What people need to say, mothers, say if you've got daughters, I need to be a part of this.
Yes, yes, and a lot of it is really, we live in such busy times. We're running to, I know COVID has us kind of at a standstill, but normally we're running through soccer practice, picking up the kids, making dinner, and we really don't realize how much, we're lacking that connection. So a lot of this is just really giving the time and space and place, to connect, and then making it very simple by giving the activities to do so that we're not having to look, okay, what do I do now? Or the resources available.
So can you tell us some of the services that you offer? And I know you mentioned retreats.
Yes.
And what are those services that you offer with Mother Daughter Empower?
So the first one that we have is it's a free membership for moms and daughters, and it's a monthly mother-daughter empowerment toolkit. So every month we have a different theme, and the toolkit is emailed to you, and you get a positive affirmation that you can focus on for the month. You have a mother-daughter challenge that you can do together. There's a journal entry in there as well. And so really, it's really to create this consistency of connection. So we usually say, once you get your kit, schedule it in your calendar, schedule at least an hour to go through it. And it really gives you an opportunity to bond, connect. The questions are already there to kind of, learn about your child, and your child can learn about you. And it's a different theme every month. So that's the first resources that I always talk about that we have available that's out there. And then